Hi, I'm Dr. Brian Reed with High Point Surgical Associates, and I'd like to welcome you to the first step on your weight loss journey. Today, I'd like to talk to you about obesity, some surgical cures for obesity, and why you might be interested in this program that we are building. Obesity is a nationwide epidemic, with more and more people being affected by this every day. By definition, obesity is a weight that is considered unhealthy for a given height. The CDC recognizes that BMI, or body mass index, is a reliable tool used for measuring a person's obesity status. A person is considered in the obese range if their BMI is more than 30 pounds overweight. Severe obesity begins at 80 pounds overweight, and morbid obesity begins at 100 pounds overweight. The fact of the matter is, obesity is a disease. It is a disease process that affects individuals just as hypertension, diabetes, cancers affect people. And as a disease, it should be treated as such. There are many factors that go into why a person is overweight or obese. These include genetic predisposition, lifestyle choices, and then metabolic issues as well. In order to adequately treat obesity, we have to approach it as any other disease process is approached, from a multidisciplinary perspective to allow for the best possible outcome, and this includes surgery. You may be asking yourself, why is it important to address obesity? The fact of the matter is that over 20% of deaths in the United States are directly related to morbid obesity and the diseases that are associated with it. We know that several cancers and innumerable disease conditions are directly associated with morbid obesity. If you could change one aspect of this disease process, think about the ways that your life may be improved. More time with your family, more activities that you may be able to enjoy that you aren't able to enjoy now, and a longevity of life that you wouldn't have otherwise if the disease weren't addressed. So you may be asking yourself, why should I consider surgical weight loss? Frankly, non-surgical interventions for weight loss just don't work. You may have experienced this yourself, whether it's dieting, medications. Data suggests that patients that have started medical weight loss do not have nearly this success long-term, and that patients who have morbid obesity have a near 100% failure rate of diet and exercise alone. Surgical interventions for weight loss greatly impact people's weight loss journey, giving patients up to 60 to 70% effectiveness in most cases. So why our practice? Let me begin by reintroducing myself. I'm Dr. Brian Reed. I'm a native of Sumner County with extensive experience in minimally invasive surgery and robotic surgery in particular, with over 1,000 cases performed. I am deeply committed to caring for the patients of Sumner County and the surrounding regions. I became interested in bariatric surgery to provide a service line that was a natural progression from my own skill set to the people of Sumner County. It is my desire to provide quality care close to home. In our practice, you will have access to my nurse, mid-level providers, dietitians, insurance specialists, as well as a mental health care team that will be assisting along your weight loss journey. Your surgeries will be performed at High Point Health Sumner. Before we talk about the various types of weight loss surgical options, let's talk first about normal anatomy. In the normal individual, food enters the mouth, travels down the food tube or the esophagus into the stomach, where the process of digestion begins. The stomach acts as if it were a washing machine, moving the food back and forth, breaking it down into smaller particles that are then passed into the small intestine, where the majority of the digestive process takes place. Enzymes from the pancreas as well as the liver are excreted into the small intestine, and nutrients are absorbed throughout the pathway of the small intestine. Food then passes into the large intestine, where the majority of water absorption occurs. With regards to weight loss surgery, there are 3 different types of procedures. First, restrictive procedures. These are procedures that restrict the amount of food that pass into the stomach. Second are malabsorptive procedures. These are procedures that decrease the amount of nutrients that are being absorbed through digestion. And finally, a combination of those procedures. Let's introduce the 4 surgical weight loss options. First, sleeve gastrectomy. Second, Roux-en-Y gastric bypass. Third, SADI bypass. And fourth, surgical revisions. During your intake process, my team and I will have discussions with you about which procedure might be best for your particular situation and your goals in this weight loss journey. Let's first talk about sleeve gastrectomy. Sleeve gastrectomy is a restrictive procedure in which the surgeon removes a portion of the stomach, leaving behind a sleeve or banana-shaped stomach, which restricts the amount of food that is allowed to pass into the stomach. This process decreases the hunger hormone, resulting in a decrease in the feeling of hunger. The sleeve gastrectomy was originally intended as a procedure to bridge to much more complex bariatric procedures, but it was found that with this procedure alone, patients had good weight loss, as well as resolution of some of their metabolic problems such as diabetes, sleep apnea, and hypertension. Currently, sleeve gastrectomy is the most common bariatric procedure in the United States. There are several health benefits that come with sleeve gastrectomy. Studies have shown sleeve gastrectomy patients experience high resolution rates of their type 2 diabetes, high blood pressure, high cholesterol, and sleep apnea. The procedure allows for full absorption of nutrition, and the patient does not have to take specialized treatments afterwards, although it is recommended that most patients take a multivitamin daily. There are certain drawbacks to sleeve gastrectomy. First of all, the procedure is irreversible. You are removing a portion of the stomach during this procedure. Additionally, because we are removing a portion of the stomach, there is a risk for leak. If that were to happen, you would have to have another surgery to repair that. However, the risk for leak is very small, occurring in less than 1% of the patients. With sleeve gastrectomy, the average patient with a BMI of 51 will be able to experience an average weight loss of up to 60 to 70% of their excess body weight. The second surgical procedure is called a Roux-en-Y gastrojejunostomy. A Roux-en-Y gastrojejunostomy is both restrictive and malabsorptive. During this procedure, the surgeon creates a small stomach pouch and then uses a portion of the small intestine downstream of the stomach, which is divided, and then attached to the pouch to bypass the lower stomach and the first portion of the small intestine. And this results in fewer calories absorbed. Studies suggest that patients that have Roux-en-Y gastric bypass have a greater resolution of their type 2 diabetes, often within days after the operation. Additionally, patients see good results with treatment for their hypertension, high cholesterol, and sleep apnea. Roux-en-Y gastric bypass also offers a greater amount of weight loss than sleeve gastrectomy, which may be appealing for some patients. The drawbacks to gastric bypass include staple line leaking, which can require additional surgery, although again, this is a very rare complication. Because you are bypassing the stomach, patients are required to take specialized bariatric vitamins for the rest of their lives. Additionally, because the stomach is now a small pouch, these patients have to be monitored very closely for the development of ulcers. Because the risk of developing ulcers is relatively high, it's strongly encouraged that patients that undergo Roux-en-Y gastric bypass avoid all anti-inflammatory medications to reduce this risk. With regards to overall weight loss, a patient who undergoes Roux-en-Y gastric bypass with a baseline BMI of 58 can expect approximately 70% of their excess body weight loss in the first year. The third weight loss surgical option is called SADI, or single anastomosis duodenal ileal bypass with sleeve. This procedure combines the restrictive power of a sleeve gastrectomy and combines it with the malabsorptive power of the bypass procedure. Because the muscle that separates the stomach from the small intestine, the pylorus, is preserved, patients feel fuller more quickly after surgery. Additionally, with this procedure, patients who have type 2 diabetes seem to have better control long-term of their diabetes. Often, this procedure is associated with the greatest weight loss of the 3 procedures that we've discussed, with patients losing over 70% of their excess body weight at the 1-year mark. This procedure does have its own drawbacks. Because of the way the bypass is performed, patients have a significant reduction in their calorie and fat absorption. Because less fats are being absorbed, some patients may have more fatty, loose bowel movements than they had prior to surgery. Additionally, due to malabsorption, patients will be required to take bariatric vitamins for the rest of their lives. As I said previously, the average patient can expect to have an average weight loss of 50 to 70% of their excess body weight at 1 year after SADI. In addition to the 3 operations we've discussed, we will also be offering revision surgeries here at Sumner. If you choose to have your surgery with our program, your surgery will be performed using the Da Vinci robotic platform. The Da Vinci system takes traditional laparoscopic instruments and allows the surgeon to make the instruments move as if my hands are moving in real time. Additionally, the Da Vinci system takes traditional laparoscopic instruments and allows the surgeon to see in 3D as well as high def and 10 times magnification. So we have better instrumentation, better visualization, and it makes for a safer operation for the patient. Overall, patients can expect less pain and a quicker return to their normal activity after this operation. For far too many people, surgical weight loss is viewed as a personal failure. The fact of the matter is, this is a tool, and this tool has proven success. So congratulations as you begin the process of considering weight loss intervention. And I frankly want to tell you just how humbled I am that you would take the time to listen to this seminar and even consider weight loss surgery in the first place. Now the next step, get in contact with our office. This is a long journey, but we're going to be here with you on every step of the way. I want you to understand surgery is just a tool in this process. This is still going to require some pretty significant dietary, nutritional, and lifestyle changes, but we're going to teach you all those tools as well. We are dedicated to making sure that you get the most out of this process. So great news, you've completed the first step. The next steps in the process involve getting in touch with our office. If this is something that you think you might be interested in, please reach out to us. Go online and check out our website and look at our frequently asked questions. Reach out to our office staff, and we will schedule you for an intake day where we discuss your individual plan and the next steps along your journey. The first portion of this journey begins today. So what can you do at home? Number 1, if you're a smoker, stop smoking now. Number 2, increase your daily activity, just a little bit every day. Number 3, start looking at the way that you're eating and keep a diary of the things that you're eating on a daily basis. Try to increase the amount of protein and decrease the complex carbohydrates that you're eating. We'll talk more on your intake day about ways that you can make healthy choices in your eating during this process. So again, thank you for taking the time to participate in this online seminar. I hope you found this informative, and I look forward to meeting you on your intake day.